Today we have a wonderful colleague, Dr. Kirchoff, did I say it correctly? Who is one of the examples of people who have done many things and have found, her way to make an incredible influence in what she's doing. I'm just going to share a little bit of what I know about what she's been up to and who she is, but hopefully she'll share more too. So Dr. Kirchoff did her undergrad at University of Texas at Austin, and then Galveston for her medical school. Then she did pediatric residency at the OHSU, Oregon Health Sciences, where she was a chief resident back in the day. Then she did general pediatrics practice for a few years before she went into more developmental pediatrics, and also did the University of Arizona Andrew Weil Integrative Medicine Fellowship, which she completed in 2016, as she mentioned, and has been working in many different ways within the field of pediatrics and development and integrative medicine, and just a wealth of expertise. And she is living in Portland, Oregon, so close to Dr. Lowenstein. And we're just delighted that she is here to share with us about pediatric anxiety from an integrative perspective of mind-body medicine. And I will give the floor to you, and would love to just hear from you and learn from you. Thank you for being here.
Thanks for having me. I'm super excited to be here. So thank you for including me in what looks to be just an amazing group of colleagues and professionals and students. And wow, so, and I think every meeting that anyone has ever should start with a meditation like the one that we did this morning. So thanks for the kind introduction. I don't know that I have much more to offer. I was a general pediatrician for 5 years and then found my true passion in developmental and behavioral pediatrics. I worked for about 10 years in a nonprofit, and unfortunately, developmental and behavioral pediatrics is not very profitable, even for a nonprofit. So we closed, and I've been in private practice for the past few years. And I love what I do. I love developmental and behavioral pediatrics, and I really love the integrative medicine piece. In Portland, we're lucky because we have a lot of complementary and alternative modalities here. And I saw early on in my developmental and behavioral work that my patients that were seeing other providers were doing better than patients that weren't, as a generalization. And that's what really inspired me to learn more about integrative medicine. So with that, I will start sharing my screen, I think. Let's see if I can make this work. And then I'll pull up my presentation. Here we go, and see if this works. Does that work? Everybody can see?
Yay, great.
Oh, technology. I should be good at Zoom by now, but there's always this moment. So I'm excited to talk with you guys about mind-body interventions for pediatric anxiety specifically. I have nothing to disclose. I'm not going to make any money off any of these mind-body interventions. And my goals are to increase your knowledge and awareness about mind-body interventions that are studied in pediatric anxiety, and also to share some specific resources in hopes that can be helpful for you and your patients. I'm preaching to the choir when I say anxiety is common. A quarter of kids have significant anxiety over their childhood, and almost 6% of those are classified as severe. I'm also preaching to the choir when I say we need better options than just standard allopathic care, because almost half of kids don't completely resolve their anxiety with sort of gold standard care. And we know that if we don't get anxiety under better control or under control, there's an increased risk of depression later. So it's important to get an effective therapy in place. The cool thing about integrative medicine is that everybody's doing it. 30% of kids with mental health issues are using complementary and alternative modalities. That's about 3 times more than sort of the general population of kids. And so we have a very interested audience here. And we know that use of complementary alternative medicine is increasing over time, specifically with regard to mind-body intervention. So this looks at the number of kids using yoga, and this is kids with and without mental health conditions, using yoga and meditation just over the time frame of 2012 to 2017. You can see there's pretty significant increases, and I would expect probably that we've continued to see significant increases beyond that since that time. I want to focus on just 6 types of mind-body interventions. There's certainly more, but I want to talk about meditation and guided imagery, which is really a subcategory of meditation, yoga, Gong Massage, Biofeedback, and Neurofeedback today. So meditation, I think we're probably all really familiar with. Of course, it's any kind of deliberate focus, and the point is to turn your attention into the moment and away from distracting thoughts. There are a lot of benefits for meditation beyond just anxiety reduction, of course, and I'm not going to go into all of those, but I just included kind of an overview there. So it improves emotional well-being, mental capacity, physical health. There's studies to support all of those benefits. When you're thinking about meditation, there's guided, like what we just did, where a teacher guides you through what you should be doing in the meditation, and unguided. So maybe just a timer, or not even a timer, your own direction from your own thoughts or absence of thoughts. And then with regard to goals of meditation, the goal can just be relaxation or calming, stress reduction, or there can be more insight-oriented meditation where you're working on developing certain qualities like wisdom or compassion. I think it's kind of cool to look at meditation, the origins of different types of meditation. So there's hundreds of types of meditation. A lot of them have cultural or spiritual or religious sort of foundations, right? The 2 types that I'm going to talk about are in yellow, the mindfulness and guided imagery, but you can see that there are Buddhist techniques, Hindu techniques, Chinese techniques, Christian techniques, Islamic techniques, and secular techniques. And this is not a comprehensive list. I'm sure there are other foundations as well. There is good evidence that mindfulness specifically works for anxious kids. There's also evidence for guided imagery working for anxious kids. And this is just one study that I found that showed a moderate and significant effect on using mindfulness-based interventions for treating anxiety in youth with anxiety disorder diagnoses. Meditation, we all probably, again, preaching to the choir, find a quiet spot, sit, walk, stand, lay down, and start meditating. It's pretty simple, accessible for almost anyone, anywhere, anytime, which is one of the cool things about it. A lot of my patients ask me, well, how often do I have to do this? And what I tell them is as much time as you can spend on a daily basis is great. Like 40 minutes would be ideal, but almost nobody, gets to that, right? 20 minutes a day would be really good. But the most important thing is that you meditate in an amount of time that's achievable for you. So even if that's 5 minutes is what I tell them, start with 5 minutes, whatever you can do. There's actually a study published that showed that 10 minutes of meditation just before an activity is associated with improved focus and attention. So you can even do sort of PRN meditation, right before a stressful event or right before something you need to focus on. So probably we're all a lot more focused during this talk because of the meditation we did this morning, right? I shouldn't say probably, evidence shows that we are, right? This is a really busy slide, but I wanted to include it. I'm hoping that my slides can be shared afterwards just as a resource, talking about the different types of meditation resources that are available for patients. So Headspace is probably the most popular one. It's kind of cool for kids because it's got animations that explain what the purpose of the meditation is, and that's really engaging. And you can, there are meditations as short as 1 minute and as long as 20 minutes. There are some limited numbers of meditations that are available for free, or you can pay a monthly fee of, I think, around $8 to access all of the meditations. You can meditate for specific goals. There's, anxiety, sleep, depression, what have you. And it's a really easy to use platform. Calm is similar to Headspace, and they have some free offerings, or you can pay for their expanded library. It's generally better for older users or for people who don't like the voice in Headspace, which is a British accent male voice, right? So Calm, I think, is a female voice without a British accent. I can't quite remember. Insight Timer has a lot of meditations. They're free. They're more diverse. You can sort by age, and it has a social media component that people really like. It's not as user-friendly as Headspace or Calm. It can be a little overwhelming because of all the choices. And then stop, breathe, and think some kids like because they choose their emotions, and then a specific meditation is recommended for them. So they like that idea. A simple habit you can use if you're stressed about a specific thing, like preparing for a date or a difficult conversation. So some people like that. There's also a social media component there, and you can turn the background sound on and off. So maybe people who like music or don't like music. That's another thing about Calm, by the way. A lot of people like music in the background, and Calm offers that, but Headspace does not. Thrive Global, I think, is important to mention because you don't have to have a computer. You just got to have one of those little Alexa or Echo things to do it. So super easy for kids to use. And the UCLA Mindful app is available in 9 languages, which is really fantastic if you're seeing a patient population that has a different language than English as their primary language. I wanted to mention Liberate because it's designed for people of color and addresses some of the issues around racism and microaggression specifically. It's designed for adults, but could be accessible for older teens. And then the MBSR classes are great mindfulness-based stress reduction. So it's a secular evidence-based intervention mindfulness training. I think it goes 10 weeks of weekly classes with practice in between classes. And there are online and in-person programs. Relaxed Melodies is great for background music. I just wanted to mention it. So little kids can also be taught to meditate or to use mind-body strategies for calming. And I just wanted to mention a few specific options that are good for preschoolers and elementary school age kids. For the preschooler category, I really like Breathe, Think, Do with Sesame. It's really cute. It's very accessible for kids two and up, right? It's great. And then I wanted to call your attention to that last one in that list, Super Stretch Yoga HD, which has great reviews and incorporates some yoga postures. So it's pretty fantastic. I'm not going to go through all the elementary school aged ones. I've put for your reference some of the pros and cons or specifics to each type, but this is a nice list to share with parents of younger kids who are interested in incorporating mind-body strategies into their kids. I wanted to focus on guided imagery specifically because I use it a lot in my practice. I find that it's really helpful for younger or more imaginative, creative kids. It's a multi-sensory meditation, so there's a lot of a discussion about what you're smelling and seeing and feeling and hearing. And so it's more engaging for the younger set. It also requires less intentional concentration. So sort of it can be helpful even if somebody's listening to it as they drift off to sleep. So there's not as much effort required. I won't go through all these, but guided imagery can be used in a very targeted way. For example, you can do guided imagery to decrease pre-procedure anxiety, or for weight loss, or for fighting off a cold, right? So certainly it can be used for anxiety, but it can be versus a meditation that might be good for general purposes. This can be more targeted. I love healthjourneys.com. So healthjourneys.com is a website that both talks about the evidence behind guided imagery, how to use it, has a huge audio library with both a kids and a teens subcategory. You can either subscribe to the app and have unlimited access to all of the guided imagery, or you can purchase individual DVDs or MP3s. Great for kids who have a media addiction, right? Because you can just get a CD player and the DVD, and then they're not in the room on their phone meditating, right? Well, quote, meditating, unquote, with their phone. And then for people who want a non-electronic option, I really like Guided Imagery for Healing Children and Teens by Ellen Curran. It's a book. Qigong Massage. I see a lot of kids, of course, with autism. Qigong Massage is an evidence-based intervention actually developed by Luisa Silva, I think, here in Oregon. It is a padding massage down different meridians that can be administered by parents. Takes about 15 minutes a day. And you don't have to have access to a clinician to learn how to do it. There's an instructional book and DVD on their website, which is mentioned here, qsti.org. It also may be good for kids with just sensory issues, although I don't think they've published on that. They've been looking at kids that don't have autism or trisomy 21, just have sensory issues. And I believe they're about to publish some data on that if they haven't already. There are practitioners that have training in this and can help parents kind of fine tune the massage. It's meant to be done daily, usually at bedtime. Most practitioners recommend 2 years of nightly massage for maximum benefit, but you can see the improvements in the first month or so. It can also be done as needed for stressful situations, right? So it's sort of an as needed, let's go do a massage. Yoga, I'm just going to scratch the surface. Keith could speak much more eloquently to yoga than I can, but a review of the literature for pediatrics for yoga is interesting, right? Because we know yoga helps, but how does it help? And that's difficult to ascertain because there's so many types of yoga, and most yoga incorporates other elements, right? So breathing or chanting or the exercise component or mindfulness. There was one study, and actually it looks like I forgot to put my references, so I'm happy to share those. You can email me. But one study showed that yoga had the same impact on anxiety that cognitive behavioral therapy does. And one study proposed that it increases GABA in the brain, both acutely and chronically. So I thought that was kind of cool. Coming back to the slide, there's a lot of kids are doing yoga, right? So in 2017, almost 5 million kids in the United States were practicing yoga. And so I think it's important to think about it as a modality, right? Again, just like meditation, yoga has broad benefits. We know that there's benefits emotionally and cognitively and with regard to physical health. Thinking about the literature again, I sort of already talked about this with regard to the literature being very variable, so it's hard to kind of sum up to a review and sum up what kind of yoga is most effective. But what did come out of literature review is that the frequency and duration do seem to be important for efficacy. So ideally, you could tell patients at least 30 minutes, 2 to 3 times a week for at least 6 weeks before you see the full effect of yoga. As far as resources, there's basically, you want to find a kid-friendly practitioner that incorporates elements that are appealing, right? So do they want hot yoga or not hot yoga? Do they want to have a more movement-based or more meditation-based yoga? Find, what appeals to that specific child. But there is one evidence-based yoga program for kids specifically called Yoga Calm. And that was developed by somebody, again, here in Oregon. But there are practitioners available throughout the United States. And so I've given you a website and a directory of providers that's on the website. What's cool about Yoga Calm is that kids 6 and under attend family Yoga Calm classes. And so kids down to newborns can attend Yoga Calm with their parents. And I think that's pretty cool because, in Chinese medicine, heal the mother, heal the child, right? And in Texas, we say, if mama ain't happy, ain't nobody happy. And what I tell my patients is if they say it in China and they say it in Texas, it has to be true, right? So it's great. Just getting mom to a class with a newborn is going to have a huge impact on that baby's emotional well-being. So, okay, biofeedback. So I think everybody's probably familiar with biofeedback, but it's using basically medical equipment to monitor a bodily function and then tracking the response of that bodily function to some sort of relaxation technique that the patient's being taught, right? So whether you're monitoring your response, your heart rate in response to meditation or guided imagery or progressive muscle relaxation, or whether you're measuring muscle tension or blood pressure, that's how that works, right? And there is some evidence of benefit for anxiety and PTSD, not as strong as neurofeedback, but a lot more accessible, a lot less expensive. There's typically 4 to 10 sessions lasting 30 to 60 minutes, costing about $35 to $85 per session. So it's financially within reach for some people that can't afford neurofeedback. And it's not covered by insurance. So when you make that referral, you have to determine whether it's something that's financially feasible for a patient. There's a specific biofeedback program for kids that's actually been really popular lately called Mightier. Some of you might know about it. It's it's a biofeedback online program. You buy the equipment and then pay a subscription for access to the program. It's for kids ages 6 to 12. It uses heart rate biofeedback. And they're video games, right? So kids practice self-calming skills in the context of sort of practice situations that might be stressful. And there's some evidence that these strategies generalize after several weeks to several months. It's about 30 to 40 a month, depending on what subscription you purchase. And there's a 90-day money-back guarantee. I do have a few patients in my practice that are using this app and who really like it, who do feel it's been of significant benefit. So my N is small, but my results are strong. There's both an ASD specific pilot going on right now and an NIH study looking at efficacy of this specific biofeedback program for pediatric anxiety, ADHD, ODD, and some other stuff. So stay tuned on that. So I may be able to soon say that this is an evidence-based intervention for pediatric anxiety. Neurofeedback. So Neurofeedback is a specific kind of biofeedback that involves sort of training the brain, right, for addressing under or overreactive specific brain activity. So whether you want more alpha waves or less theta waves, or more frontal cortex activity or less amygdala activity, right? There was what I love about neurofeedback is that it seems to be one of the more effective interventions in my experience for PTSD specifically, which I think we all recognize can be really hard to treat effectively. And it's also good for anxiety. You can use it in kids down to 5 or with an experienced practitioner down to even 3. And it's a computer game based system, right? So kids play computer games, and when they alter their brain activity in the desired way, they are more successful with the video game. And there aren't that many kids who don't like video games, so they don't tend to protest the situation, right? They like going to the appointments because it's video games, right? The drawback is expense and time, right? So they're typically, for a course of neurofeedback, you're looking at $3,000 or more. It's rarely covered by insurance. You're also looking at 2 sessions per week, 20 to 40 sessions. For my patient population, they're usually at the higher end of that. And then it's important when you refer for neurofeedback that you know what types of neurofeedback that provider has training in or is able to use. There are, I think, 6 or 7 sort of main types of neurofeedback, and there's a lot of sort of custom built neurofeedback programs as well. But there are studies, there's one study that I found actually that is referenced below that talked about specific indications for specific types of neurofeedback. So for example, if you had a kid who had a TBI and anxiety, they might be a good candidate for a lens neurofeedback. If they were struggling with insomnia and anxiety, maybe they use the frequency, power, or surface neurofeedback. If they have OCD specifically, maybe they're a better candidate for somebody who does low resolution electromagnetic tomography. And so making sure that the practitioner that you're referring to has the ability to use a style of neurofeedback that has evidence for your patient's specific anxiety and comorbidities is really important. And I hopefully I made it under time. I practiced, so hopefully I did it without going over.
Wonderful. Thank you so much. I know I learned quite a bit, and I just want to thank you for sharing such breadth of interventions and principles. And I also want to open it up to our